Hi guys, today is Justine Davis coming at you. So today we're gonna talk about sex reassignment surgery. Um, it's where a man cuts his thing to have a vagina. It's where a man that wants to become a female dreams come true, and some of them, yes, don't have a good how can I explain it to you? A good story afterwards. And then maybe somebody when they change it, they are shocked by it, or they don't want to be a girl anymore, but it's already late, you understand what I'm saying? Anyways, the lights still lower down. Yes, today I'm not giving you makeup because I'm not feeling it, and I don't have to wear makeup to look female-like, so, yeah. Anyways, for today's thing, I am an MTF, which is male to female, transgender for those who don't know me. I'm transsexual, sorry. Transgender is mainly the one that feels as a female within trapped in the male's body, while the transsexual is the one that's actually going medically transforming into a female little by little. Well, I'm transforming little by little to a female. Anyways, today's the subject will be about the sex reassignment surgery, like I already said. Sex reassignment surgery, or SRS, also known as gender reassignment surgery, gender confirmation surgery, genital reconstruction surgery, gender affirmation surgery, or sex realignment surgery, is a surgical procedure, in between parentheses, or procedures, by which a transgender person physical appearance and functions of their existing sexual characteristics are altered to resemble that socially associated with their identified gender. I'm so sorry, girl. I haven't read it in a long time. Well, I do read, and in my brain sounds amazing, but I need to read out loud in order for my voice to get adjusted and my tongue and everything. Yeah. Anyway, where are we? It is a part of the treatment or gender dysphoria in transgender people, which, yeah, I can relate with that. Related genital surgeries may also be performed on intersex people, often in infancy. I don't know how you say that. I think that's what it is. A 2013 statement by the United Nations Special Rapporteur on Torture. What the fuck? Nations Special Rapporteur on Torture. I don't know what that means. I know that it says it's spelled RAPPORTEUR torture. So it's a reporter on torture. Whatever. Condoms. The non-consensual use of normalization surgery on intersex people. Excuse me. What the fuck is intersex people? Give me a second. Sorry. Oh. Intersex people are born with any of the several variations in sex characteristics, including chromosomes, gonads, sex hormones, or genitals that, according to the UN Office of the High Commissioner for Human Rights, do not fit the typical definitions of male or female body. Such variations may involve genital ambiguity, and combinations of chromosomal genotype and sexual phenotype other than XY equals male and XX equals female. Intersex people were previously referred to as hermaphrodites, congenital eunuchs. Bitch, I'm trying to learn English, and then you're gonna freaking say all the words. Or congenitally frigid. Anyways, I don't like looking down. I'm talking right now, but I'm trying to read, girl. So you me and you. Well, I don't know what the heck is this, intersex people, but I'm learning. This is the best part about looking information. You actually get to the point of learning all the things. Such terms have fallen out of favor. In particular, the term hermaphrodite is considered to be misleading, stigmatizing, and scientifically suspicious. Specious. I said suspicious. It's specious. Medical description of intersex traits as disorders of sex development has been controversial since the label was introduced in 2006. You're not telling me what they are. Anyways, whatever. Let's go back to the SRS. The American... Okay, wait. Yeah, the American Society... I can't even say this. The American whatever of the Plastic Surgeons, ASPS, calls this procedure gender confirmation surgery, or GCS, another term for SRS, including sex reconstruction surgery and more clinical terms, such as feminizing genitoplasty or penectomy or archaeotomy or and vaginoplasty. That's what I'm gonna get. Are used medically for trans women with masculinizing genitoplasty, matiodioplasty, or phalloplasty, often similar use for trans men. People who pursue sex reassignment surgery are usually referred to as a transsexual, derived from trans, meaning across, through, or change, and sexual, pertaining to the sexual characteristics, but not necessarily sexual actions of a person. Girl, let me know. So yeah, that's what it is. After a year, I'm actually not considering. I'm doing this. I'm actually gonna get my SRS because I want to. This is my body, and oh yeah, my titties are growing. They look nice. Oh my god, I am so proud of them. Anyways, I'm talking like they're my children or something. So they are my babies, bitch. If it worked for them, I would not look good, but I'm not gonna look sexy because I have them. Anyways, so then it gets to the point that yes, people ask me, oh yeah, let's just find questions about like usually what people ask for the SRS and whatnot. Do a transsexual? Oh. I make so many faces. Focus, MTF. Girl, this is not the questions. Let's just say this are good too for people that don't know. How long will it take me to recover from vaginoplasty, which is male to female, like me getting a vagina? After 3 days in the hospital, you will need to stay in the certain hospital area for about another 12 days. When available, most patients stay at one of the studio apartments above or their office, which rent for only $50 per night. You can bring a companion at no additional charge, and you can be seen daily. To be honest with you, you don't have to be afraid about this, because the thing here is, it depends on the hospital and where they're gonna do it. Like, this is just some random this is the Philadelphia Center of Transgender Surgery. So mainly if you're in another place, it will be other, like, how do you say it? Other rules. So don't worry about it. There's also other informations. It's how people are and how their experiences worked. You feel me? So like if a doctor did something different and then this doctor did something different, but it's still the same thing, what works for them and their rules, if they work for them and this one works for them, well, they will tell you probably will be the same, but at the same time, the person is not the same. So it will be like either told different or it's going to be another different way of taking care of yourself, but still will work the same way the other person would say, if you know what I mean. Anyways, when can I go back to work after vaginoplasty? Most people return to work after vaginoplasty in about 4 to 6 weeks. You can resume strenuous work and exercise in 6 weeks to 8. Okay, that's good. How often do I have to dilate? Dilate is like once you actually get to the point of male to female, having a vagina, like getting the vagina, I am so sorry. The surgery, let's just say it's surgery because, yeah. You have to dilate in order to maintain your depth. Because females, this is what I learned yesterday from Bianca. Shout out to Bianca, girl. It got to the point that she says that once a female actually has intercourse with a guy, it like expands. But then it gets to the point that it contracts and then it closes down again. Well, for us, once we actually get the surgery, it's like let's say it's like a wound. You know how it like closes unless you like if you don't keep taking the scab out. I'm sorry, it sounds disgusting, but I know. If you keep like opening, you know that that's gonna close. But here is different. This one is more interior, and not only that, it just gets to the point that if you think about it, we had to dilate with that thing that they give us because I don't know how to explain it. It's like I don't even know if it's silicone or whatever. Excuse me, I'm sorry, I'm sick. I didn't want to make a video today, but whatever. Because I actually committed to do it freaking Mondays, Wednesday, and Friday, and I'm here, girl. Let me tell you. Anyways, so then it gets to the point that we need to, it's different sizes. And then every 3 weeks it changes, I think it is. I think it's 2 weeks or 3 weeks that you have to change the, how thick the thing is. I know it sounds really sexual, but it's true. Like, girl. Anyways. This is so easy. I'll just show you a picture right now, girl. Anyways, so yeah, that's like the dilation. Another thing I was actually going to tell you is, excuse me. Oh my god. That not all dilators are gonna be the same. Like I said, for some people this works and then the other people work, so they basically just create the same thing, but or like explain the same situation but different. Excuse me, but nothing. Basically, you have to dilate in order to keep your depth. Let me just procedure. I have actually looked for this information a long time ago, but it's not bad for you also to learn, you know. Anyways, why did you? Oh, I was about to say bitch. Sorry, I'm just sticky. Oh, this is weird. That's another situation. No, this is not a place where I want to go. There's I'm gonna show you a video of like I'm gonna put the link down below about lots of things with their information and everything. So if you actually feel like you want to read and you want to like self-educate yourself, especially with transgender actually talking about it, I'm gonna put it just down below, like Miss Jules, and there's not other person that actually talks about it. I forgot what it is for now, but I will like explain to you. Like I'll put it down below. Anyways, so yes, how often do I dilate? Wait, yeah, how often do I dilate? Our recommended dilation schedule is as follows: from 1 week to 3 weeks, 4 times a day. That sounds crazy, but it's true. For the 4th week to 6 weeks, 3 times a day. From the 7th week to the week 9, 2 times a day. And from week 10 to week 12, 1 time a day. Week 13 and forward, dilation or intercourse, a minimum of once or twice a week for the rest of your life. Yeah, tell me about it. What about orgasms? Most, if not all, of our patients are able to have orgasms following MTF surgery and vaginoplasty. Some people experience orgasm within several months to a year and a half. Yes, I'm gonna feel orgasms. What do the dilators look like? The dilators have a shape similar to a candle, but they come in different sizes, from small to large. When dilating, you should use the largest dilator, which fits comfortably in the vagina. I'll show you the picture. Like, that's one of the pictures that I showed you. You can use any other type of dilator, dildo or vibrator, as long as it fits comfortably into the vagina and does not cause pain or injury into the tissue. I am not gonna, no, I'd rather use a dilator than a dildo. Because if you get to the point of thinking about it, the dilator, it's like flat surface, you feel me? So, I'm actually just training my vagina to grant that. But if you get to the point of thinking about a dildo, well, depends on the dildo, because they come in weird, like, different shapes and weird shapes, and, well, yeah. I don't want to use a dildo in where, like, it looks like an actual penis, because, hello, duh. And then it gets used to, like, you know how some penis are different and whatnot, so it's like, it has the head, and then like, the head is bigger than the one in the back. Well, it depends. Well, I don't want that to get used to. I'd rather get used to it, to a full thing. You feel? Never mind. If you understand me, then thank you. If you don't understand me, then thank you. It's okay, as long as you try. What the fuck? Do I need to do it? Following removal of vaginal packing, 1 week after surgery, recommend douching every other day for the first 3 weeks, and then once or twice weekly in order to keep the vagina fresh and free of abnormal bacteria. That's gross. Yeah, I don't want that shit. Remember that lining of the vagina is normal skin, and this has a different pH and different natural bacteria, floral, than natal vaginal mucosa. How long will it take for my scars to go away? To be honest with you, as a transsexual, people have asked me if so far have something wrong that I don't like. I'm going to become a female, so any changes that I actually get, either bad or good one, or gaining weight or whatever, it's part of the process. Like, I signed up for this. This is what I want, not because I want to look better for you, or like, no, I want to do it because I want to be myself. You understand what I'm saying? I want to also grow as who I am meant to be. So, like, I don't care if it's something ugly that grows out of me, or like I get overweight. No, I don't care. As long as I am who I am, and I'm a female, and I look, and I can represent, and I can help people also, that's all that matters to me. I don't care, and all this, like, when I have my scars, I actually should be proud that I have my scars. You understand what I'm saying? Like, I got that surgery. I am me now. That's the thing here. I don't feel like anybody that actually got the surgery, I understand. It's like kind of a reminder of what you actually needed to go through. But be a bigger person and then just think like, I went through it. I am who I am. I am standing where I am standing. You feel me? Like, people would have wished to be me in this situation and not worry about the scars. That's how I don't care about the scars. But let's like explain. How long will it take for my scars to go away? Scars never disappear. All scars are permanent. It takes about 1 year for scars to heal completely. And during the first few months, they are usually pink or reddish and sometimes tender and raised. But between 6 months and a year, they usually become flat, white and soft, and are barely visible by 8 to 12 months after surgery. What does the fee for SRS cover? The total for male to SRS are $19,150 and include the surgery fee, the operation room, and the anesthesia fees, and 3 days in the hospital. The only other costs you will incur will be transportation to and from Philadelphia and full lockdown while you are recuperating. Period. You will need to be in the Philadelphia area about 2 weeks following surgery. Our studio apartments cost only $50 a night, which is much less than a hotel. And Dr. Lays, that's his name for this, like, transgender, like, for this area, for like Philadelphia, like transgender thing, can see you daily. What other costs are involved for surgery? The only other costs you will incur will be for your transformation to and from Philadelphia, and for food and login during your recuperation. I feel like, girl, he already answered that question. Anyways, it got to the point that I'm gonna put the link down below the video in order for you to like watch it and know what you're not know what you're talking about, but like so that you can read it yourself. And if you have any questions from the Philadelphia Center for Transgender Surgery and stuff like that, you can go to this website. I don't know where I'm gonna get my surgery yet. Before a year, before I do my first year on hormones, like my therapy, I'm actually gonna go and look for permission the 9th month of HRT. Shows that I'm ready once I actually hit the first year so that I can actually keep looking for information in order to get my surgery. Anyways, that is for today. There's also surgeries I'm actually thinking about doing in the future, but to be honest with you, it doesn't I'll explain it in other videos. I didn't want to explain on this because I want to have videos in where I can talk about things. Makeup tutorials are gonna come. Be patient with me, I'm sorry. And another thing I was gonna say is, in my videos, I think I already said this, but let me just repeat it. Once I actually start, how can I explain it to you? Makeup tutorials again, what I'm gonna do is one face in English, and then the other part will be in Spanish. My Spanish is not good because I'm actually forgetting, and I'm actually getting to the point of only talking English, but bear with me. And yeah, half Spanish, half English. I don't know which half is gonna be in Spanish. I don't know, I understand, it's gonna happen, but it's gonna happen just to help people. Anyways. So, that is it for today. I'm actually getting my vagina, excuse me, my SRS, and I'm also getting all the surgeries that I will talk about in the future. Other than that, thank you for watching the video and not skipping through. If you actually did skip through, thank you so much either way for skipping through and watching the video. As long as if you did skip through, just leave a like. You know what I'm saying? And subscribe. Anyways, so then it gets to the point that this is where I say goodbyes. Thank you for being here and supporting me in my journey. My things are growing. And I'm happy about it. But other than that, like, share, subscribe, comment. What would you like to see next? And well, we will be here, honey, because duh, who wouldn't? I'm fun. Yes, today I was all natural. I didn't want to do any makeup. But anyways, bye guys.